I chaired a session on interstitial lung disease and circulating tumor DNA. For the interstitial lung disease, it was a really thorough overview of a very common clinical problem. So we know these patients with interstitial lung disease have a higher incidence of cancer, lung cancer, and can present with earlier stage disease. The problem is that our treatment options are limited by their comorbidity. So they have increased risks of biopsies, surgery, radiotherapy, and we don't really know how to treat these patients. So we got a very good overview from a respiratory consultant who outlined to us that actually this is not one disease, it's 200 diseases. We always think of it as one. So that was a real learning point for me, actually. And then a really nice overview of the data presented by Professor Hatton that is already out there, which unfortunately is limited, and a lot has been generated in Asia, so may not be applicable to our UK population. So I think the bottom line from that is that as a UK community, we really need to look at our practice, at least capture our practice, and potentially think about a study as to how we can best manage these patients going forward. The second half of the session was very much based around the national implementation of the circulating tumor DNA. So we've been running a pilot for the last 2 years within NHS in England, looking at patients with suspected lung cancer, first presenting to a lung physician and having a circulating tumor DNA sample taken at the time when they present. And we've now done over 2,500 cases. It was in BBC News recently that this has been expanded to 10,000 cases over the next year. And so this was a chance to share learnings as to the challenges of doing circulating tumor DNA, including just the practicalities of getting the sample, working out where to send it and how to interpret the report and how to use the report, but also the benefits to the patients in terms of time for reduction to treatment and also the ability to reduce the need for repeat biopsies.